Arthroscopic anatomy of the ACL and femoral footprint is the most crucial part which determines the success of a ideal ACL surgery. A generous notchplasty may be needed, and the first important thing is to isolate and demarcate the resident ridge or the lateral intercondylar ridge. You should not make your tunnel anterior to the lateral intercondylar ridge, as if you make that, the tunnel will be anterior and the patient will have a non-anatomical ACL. The second most important landmark that you should see is a lateral bifurcate ridge. It separates the anteromedial and the posterolateral parts of the ligament, and you should ideally recreate the anteromedial bundle of your ACL. So what we need to do is we need to isolate, demarcate the AM bundle, mark the center of the AM bundle, and that is the ideal location of your femoral tunnel. So if you make that as a femoral tunnel, you will be anatomical and you will have a great result. So what we are doing right now is we are preparing and cleaning up the remnant on the anteromedial insertion of the footprint. Once we are clear, we would identify and see the posterior wall. This is very important. Just spend some time in evaluating this anatomy. The resident ridge, the bifurcate ridge, and just above the bifurcate ridge will be an area, and the center of which you have to mark it as the center of your footprint of your ACL tunnel. And this you can use either a marker to mark that center, and if you are confident with that marker, then you can go and proceed to make your ideal femoral tunnel insertion. So here we have demarcated and marked the femoral entry point, which is at the center of the AM bundle. So once you are done with that, I usually use a marked bead pin to pass the wire through the marked bead pin. We go in, and there are two ways to, there is marking on the femoral bead pin, and this R is a retro gauge marking, and I would measure my femoral tunnel length from the backwards to front, and this will be a very accurate measurement that I would get for my femoral tunnel length. So femoral tunnel position is important, the femoral tunnel length is important, and after that I would drill it according to my calculations depending on what I am using. I am using a fixed loop or adjustable loop, and then I would make my tunnel, and then I would just show you the tunnel. So when we show the tunnel, we can see, we have to see two things: the lateral cortex should be intact and the posterior cortex should be intact, and this will guide you for an exact location of your femoral tunnel.